Hello, my name is Lydia Lauder and I'm the National Director of Programs and Public Policy, and thank you for joining this session on empowering self-advocacy. Before we begin, I'd like to review on how to participate in this session. Please feel free to enter any questions you may have throughout the presentation. We'll collect those questions, and at the end of the presentation, we'll address as many as we can. You'll also have the opportunity during the Q&A period to ask questions live as time permits. I invite you to send any further questions to kidneyprograms@kidney.ca. Please remember that the Kidney Foundation is not able to offer medical advice. For specific information about your own situation, please speak with your healthcare team. And now it gives me great pleasure to introduce you to our moderator for this session, Tyler Murphy. Over to you, Tyler.
Thank you so much. My name is Tyler Murphy, and I'm a renal social worker through the William Osler Health System, working out of the Etobicoke Renal Center connected to Etobicoke General Hospital. It's my pleasure to be here today and to be your moderator for this session. I'm joined by some amazing speakers, including a patient, a caregiver and living donor, a nurse practitioner, and a nephrologist. Our first speaker today is our patient partner, Elise. Welcome, and over to you, Elise.
Thank you so much for having me. First, I would like to acknowledge that I currently live and work on the unceded territories of the Coquitlam First Nation, Stolo, Tsleil-Waututh, Squamish, and Musqueam nations. A bit of background on myself. I was diagnosed with polycystic kidney disease when I was about 21 years old. Polycystic kidney disease is an inherited disorder where cysts develop primarily within your kidneys, causing kidneys to enlarge and to essentially lose function over time. We have a really long history of PKD in my family. My grandfather sadly passed away from complications of PKD in 1992 after being on home dialysis for about 20 years. My dad had a transplant in 2001. And he was very fortunate. He never had to go on dialysis. He received a kidney from a coworker who just decided that he generously wanted to donate to my dad. And then my uncle had a transplant in 2012, I believe, after a few months on dialysis. He was also a unique situation where he participated in the paired exchange program. So his wife, my aunt, donated to another person, and then my uncle was able to receive a kidney from an anonymous person. So as you can see, it's gone on for quite a while in my family, and now my cousin Bryn and myself are the next generation of PKD patients in our family. As I mentioned, PKD is inherited, and so any children myself or my cousin Bryn may have in the future, they will each have a 50-50 chance of having PKD. We're actually quite fortunate now because there is genetic testing. So I've participated in genetic testing through Women's Hospital in Vancouver, so which is now available. And so we can go through genetic testing should we choose. Just on a quick personal note, I've worked in event management and production since about 2010. And just recently in August, I decided that it was too difficult to manage my kidney disease along with working like 16 or 18-hour days. So I've decided to go back to school and pursue psychology and criminology, and hope to one day work with kids that are going through their own medical challenges. I love to take my 2-year-old lab puppy out for walks every day. He might actually make an appearance shortly. He's getting into something over there as we speak. When I was approached to participate in this panel, I reached out to my family to hear perspectives and their own experiences. While we've each, had our moments of frustration within the medical care we've received, I can't go on discussing those situations without acknowledging our privilege as white and English-speaking people in Canada. Even in 2023, Indigenous and other peoples of color still experience significant barriers to access empathetic healthcare. For those of you who are watching that are doctors, nurses, social workers, and other healthcare providers, I urge you to dig deep into your soul and ask yourself how you are still affected by systemic racism in your practices. Systemic racism still plays a huge role in how Indigenous and other people of color are treated within the healthcare system. Since I'm white and non-Indigenous, nor is my family, we can't speak on the lived experiences, but I wanted to use my platform today to bring those issues to the forefront of our conversations, especially since kidney disease is one of the most significant healthcare issues facing Indigenous people in Canada. For me, I have experienced my kidney pain being downplayed by many doctors, especially when I have received care in the ER. With PKD, one of the side effects I had is frequent kidney infections and kidney stones. While I had felt this pain before many times, I remember one really particular situation where I experienced doctors ignoring my pain. I was in my early 20s and was experiencing excruciating pain in my kidneys or flank area. I knew it was related to my PKD and ended up taking myself to the ER. The first doctor I saw in the ER asked me if I had taken oral ibuprofen or Tylenol to help with the pain. First, I had been told since the very beginning of being diagnosed that ibuprofen must be avoided as it will affect your kidney function. So the doctor didn't even acknowledge that. When I said that I had not taken those because it wouldn't touch the pain, he rolled his eyes and just kind of blew me off. The doctor went on to say in the most derogatory tone of voice possible that you in fact cannot feel your kidneys. He insinuated that I was making up the pain. When I tried to explain that I had felt this pain before, just not as bad, and that I had PKD and very large kidneys, or that my kidneys were significantly larger than the average person, he blew me off and said, well, we can do an ultrasound if you like, but again, he was just blowing me off. Eventually, he moved me back to the waiting room as I was hunched over in pain and crying. He ignored me completely. After a couple hours, I was finally given an ultrasound and went back to the waiting room. After the ultrasound, he called me back in and said, well, I guess your kidneys are quite large, and finally gave me some IV morphine. He never apologized and never really acknowledged that I was in fact right, and that I was experiencing not only a raging kidney infection that required IV antibiotics, but also that I had 2 very large kidney stones in my left kidney. So, you know, I was asked to provide some tips in terms of how people can be a better advocate for yourself. And for me, the most important is to trust and learn your body. Your body will give you signs of what you're feeling, and you should trust that. I know the first signs of a UTI becoming a full-blown kidney infection. I have worked very closely with my medical team and now have antibiotics ready at the pharmacy should I feel a kidney infection or a UTI coming on. I have learned when it is important for me to take myself to the ER. I know the signs and the symptoms, and I have a great relationship with my medical team. I also know in advance which hospitals I should go to based on what time of day it is. I have a local hospital near me, Eagle Ridge, but they're much smaller in a community hospital and don't often have nephrologists on hand to discuss my situation. So in that situation, if it's late at night or on a weekend, I go to the much larger Royal Columbian Hospital, which is farther away, but I know that I will get better care. My family has provided me some of their own experiences where they have had to be their own advocate. My dad recalled, and I believe they're watching right now, my dad recalled a specific time when he was just post-transplant, and he had a visiting doctor from Japan Unfortunately, he had very minimal English, so there was a huge language barrier. My dad ended up bringing up his concerns to his main doctor, and they found a solution. Back then, when he received his transplant, the Kidney Foundation of Canada didn't have what they now have called a kidney suite. So these are local housing options for patients that are requiring transplant or care for kidney transplants or kidney care. And so they're able to stay in these housing. Unfortunately, when we were going through this process, we were not provided that, as it was not an option yet. And we were housed in an apartment that actually had mold all over the kitchen and around the windows, which for those of you who have gone through transplant, you would know that mold is definitely not a good thing to have while you're just beginning your immune suppressant medication. My dad was also an advocate when the standard back then was to actually have to stay in Vancouver, close to St. Paul's Hospital for 3 months. And he advocated for him and his family and for himself, and only ended up having to stay in Vancouver for 5 weeks or so, which was pretty rare back then. We grew up on the island, so in Victoria. So for those of you who don't know, that's about a 2-hour ferry ride plus driving. So that was a big deal for him. My brother and I was about 11 when he had the transplant, and my brother would have been about 9. So we were still pretty young and separated from my parents. Sorry, I'm just reading a comment. So I think it's really essential that you know what you want when you go in and to have frank conversations with your medical team. I truly believe that the majority of the medical teams out there want the best for you, but unfortunately they're their own crises right now. As we all know, the medical system in Canada has been harshly hit by COVID and all the subsequent issues that followed that. So it's important that you stand up for yourself and you recognize that what is important to you and to go forward with that. My other tip is to go, and this is something I haven't done very well, but it kind of goes on the idea that your doctors and anyone you see in your medical journey is bringing your own medical documents or records with you so that you can specifically relay what's going on, like whether it's your blood work or any other medications that you're on. Bringing that information with you is really helpful so that you can have open conversations with your medical team. I think that was all that I had to say.
Thank you so much, Elise, for sharing those powerful examples in your journey so far. I'm sure many people in this session can relate, and I'm sure we'll be getting a lot of comments and questions for you later. Now I would like to introduce our representative of our caregivers and living donors, Francine. Francine, we're really excited for you to share your journey of empowering yourself in this dual role. So I'll hand it over to you.
Thank you so much, Tyler. And I will speak from 2 perspectives today as being a caregiver and sometimes also reflect what other caregivers are experiencing. So both personal and also on behalf of the others, and also being a living donor. So thank you so much for this opportunity. So to begin with, what have I learned in terms of supporting my loved one who has a chronic kidney disease? I try to be very present and try to listen as best as I can and to validate what I'm hearing in terms of what my loved one is experiencing. It's often difficult because you're not the one going through it. And so you really try to be empathetic, but sometimes it is difficult. And try to check in daily, you know, how he's doing. I'm a caregiver to my husband, and the timing of conversations and potentially the questions that I'm asking is also super important. Sometimes He's having good days, other days, less good days. And so I really have to be sensitive to that in terms of the timing. I'm really there to encourage and to help support in so many different ways what his needs might be. In terms of helping to advocate, which is the theme of this talk, before a medical appointment, we could discuss what issues he might raise and what he's comfortable raising, what questions he might want to ask. And so we kind of review that from time to time. I'm a type of take charge kind of person and just get into action. And so the thing that I've learned was try not to take over and to really let him be empowered and handle as much of that as he can. And that varies also from time to time, because sometimes he might be feeling better than other days, and my role might also change in that case in terms of, you know, what things that he can handle. So for example, when he was on PD, he quickly took on, you know, the machine, and we quickly got into like sharing some of the roles. I would help with bringing the supplies, but he did all his own hookups. And so we got into a bit of a groove, a bit of a rhythm there. And that was, you know, sharing some of the roles. The second part of what I want to talk about today is what have I learned, or what have I done to support my own voice and well-being as a caregiver, not to overstress. I must say that at the beginning in 2015, when he was hospitalized on an urgent basis, it came to us as a real shock. There was no noticeable symptoms beforehand. So it was really, we were overwhelmed and kind of numb at the beginning. I became, because at that point I had to kind of take charge of certain things and handle the things around the house, I became very stressed and overtired. And I think that as caregivers, that is a bit of a symptom of what we go through. We tend to overextend ourselves and so focused on caregiving that we sometimes forget ourselves in the process. And or emotions or feelings that are very common to many of us, we might become very irritable, frustrated, impatient, and feel resentment towards the disease, not so much to our loved one, but just the disease itself, you know, with what cards we were dealt with. This is where the peer support group, the caregivers group that the Kidney Foundation has, is so valuable to all of us, because it's a safe place. It's a space where we can share some of those frustrations, but also a place where we can encourage each other and support each other. And it's tremendously helpful to all of us. So I encourage people to sign up for the caregivers group with the Kidney Foundation. I also had to come to a place of accepting my own limitations. Like I said before, I am a type of person, take charge, like, you know, let's go attitude. And I had to really come to accepting that there were some things that I could change and other things that I couldn't, and be really mindful, develop that mindfulness of when I was starting to get into overload and having that self-awareness. It developed over time. It didn't happen right away. And to have grace with myself, understand that there were some things that I couldn't do, and that there would be good days and not so good days. And so, you know, just accepting that. I also made a decision to choose to have the right attitude. So add humor to the days. My husband has a tremendous sense of humor, so that was a gift. That is a gift, and I'm blessed. And I tried to develop a little bit of that too alongside of him. The other thing I did was I had many friends that had offered to help. And at the beginning, I thought, oh, I can handle it. And so in time, I did accept their help, and I reached out to family and friends and my church family also to accept what they were offering to help me with. And over time, I also started to regain a little bit of, you know, the part of my life that I felt I was losing, a degree of normalcy or part of my life back. So I slowly reintegrated things like having lunches with friends and doing social outings, things that have brought me, that made me happy. I also remember sitting down and making a list of the things that bring me joy. the kinds of things that will help to energize me and refuel me. And I became really intentional about that. So I didn't just make a list, I actually moved into action. So some of those things are, you know, I'm a person of faith, and so making sure that I prayed every day. Turn to music. Music just feeds my soul. And I would sing, I would dance, I would sit at the piano pretending I was composing these amazing tunes. But it really helped me to be able to bring the things that would, again, strengthen me. And so as caregivers, we absolutely have to find the time for ourselves. It's the only way that we can continue to help, to give, and that will sustain us over the long haul. I encourage every caregiver to seek those things that bring you joy, you know, find your own outlet, if only to sit, take a break, breathe like we heard at the previous session, and mindfulness, get outside for a walk, do whatever it is. But it's so important to take that moment for yourself so you can then be better and able for your loved one. The last part I'm going to talk about is as a living donor and what tips or examples I have learned. So from the outset, I knew I wanted to be my husband's donor. And so next month is a milestone for us. We're celebrating 5 years since the surgery. And so things are going very well there on that level. So when I was going through the process, as I was cleared to be a donor, I reached out to a friend and had asked her lots of questions. We had a number of conversations. So I really leaned on her tremendously. And I, again, encourage potential donors out there that are listening to contact the Kidney Foundation, and they can set you up with a one-on-one peer connect and have that person next to you that's going to, you know, be able to reassure you and to answer your questions. I also, during the whole testing process, also advocated for myself because I have a bleeding issue, and that was a condition for me of surgery. I thought they have to take this seriously, and so they did. They gave me a blood clotting agent at the time of surgery, and really reassured me that I would be fine. The other thing too is that the surgeon, the urologist, and the resident answered all my questions. The resident actually drew a picture of exactly what was going to happen during the surgery. I love anatomy, and I really wanted to understand it all. So I left there feeling confident and reassured in terms of what they were going to do. And finally, I just wish I would have understood EGFR better, because I was left with a number in my head post-surgery of what my range would be, and it was not what came to be. So for 4 years, I was always disappointed when I'd get blood work done. And finally, last year, one of the nephrologists explained to me the difference between the pre-number and the post. And so now I'm at peace with it because I know I'm within range, and that's fine. But it's something I wish I would have understood better. And a lot of gratitude to the medical team at the Ottawa Hospital, and you know, during the whole process and even post-surgery, and also to the Kidney Foundation. They've been a tremendous support and help with all the different programs. And I also want to mention that there is a group for transplant and donors. So we have a monthly meeting. So again, I encourage you to sign up for it. It's tremendously beneficial to both transplant recipients and donors. And I think that's it for today. Thank you so much.
Thank you so much, Francine, for your wonderful story, highlighting the importance of self-advocacy and the impact. And also congratulations on your upcoming milestone. That's amazing. So it's my turn now. I'm gonna talk about my role as a renal social worker and how I can assist you or other patients with your own self-advocacy, and ultimately a little bit too about self-management of your own care. So as previously mentioned, I'm a social worker at the Etobicoke site of William Osler Health System in Etobicoke, Ontario, for those of you who are not familiar with the area. I work with people who come into our multi-care kidney care clinics, so they are not on dialysis, but are experiencing chronic kidney disease, and they come to our multidisciplinary team on site. I also work with patients on peritoneal dialysis and hemodialysis. So at our site, the social workers work with patients across all the different modalities. In other locations, you may have a different social worker working for each of the clinics, but I just wanted to explain how it works at our site. On a personal note, I also have a close family member who has chronic kidney disease and has been had this diagnosis since I was a small child, which was a lot longer than I want to admit here as this is being recorded. So I've seen firsthand how a person's ability to manage their care and advocate for themselves can lead to positive incomes and more positive experiences while going through this journey of their health. We've talked about self-advocacy, and Elise and Francine have given us wonderful examples of it. And self-advocacy is actually one dimension of self-management of care. There are others, and they do interrelate together, including communication, self-care activities, adhering to medication and treatment, and being a partner in care. And as a renal social worker, I've been able to help guide and support my patients with all these different aspects of self-management. And I'll be giving some examples of how I've been able to do that and how other renal social workers may be able to assist you as well. I just wanted to say that a lot of research has actually been done in this area, and they've shown that a person's ability to self-advocate for themselves and their ability to manage their care actually has a lot of positive outcomes, including decreased hospital visits. And the more confident a patient feels in their ability to self-advocate for themselves and their ability to manage their health, the better as well. Now, some patients, it's easier to navigate their healthcare journey. They're comfortable asking questions. You have a clear sense of what your goals of care are. You are able to take care of your physical and mental well-being as well, and are able to advocate for themselves when needed. However, some of you may not be that confident to do this. You may feel overwhelmed and not know where to start, or may think because the word self is there that you have to do this on your own, which thankfully is not the case. This is where a renal social worker like myself can be very beneficial if you're struggling with the idea of how to self-advocate for yourself and how to manage going forward. I recently had a new patient, brand new to our kidney care clinic, ask me, what can I do to make sure I'm okay? What can I do to make sure that this situation is going to be as okay as possible? And if I need to start dialysis down the road, what can I do to make sure I'm mentally ready? And I was blown away by these questions, because often new patients are so overwhelmed. Sometimes you don't think about the future. And she was taking it upon herself to realize that there were things that she can do. There's information that she needed to feel comfortable, and she would feel more comfortable planning for the future. So I told her that this was a great first step. And by communicating these things to me, we were able to have a conversation about different what ifs. What if this were to happen? What if she were to feel too ill to work? What if she would need supports down the road? We were able to talk about different modalities already in her first visit, because she was open to that, thankfully, but listening to what her worries were and seeing how she was processing the information, I also was trying to cue into, is this too overwhelming? What information does she need to feel comfortable? And I wanted to make sure that she left the clinic feeling empowered and feeling in control of the situation, rather than feeling lost or overwhelmed. So sometimes self-advocacy, it can look to be in smaller interactions, asking those questions, making sure that you understand. If you don't understand, it's okay to say, I need you to repeat it. I need you to explain it to me again. We have some patients who are too worried to ask their nephrologists repeated questions because they don't want to appear like they're not understanding or they haven't been paying attention. They are. It's just it can be such overwhelming information that you need it to be repeated. And I often joke with my patients that I'm the non-medically trained person on our team. I've got a team with great doctors, great nurses, great dietitians, great pharmacists who have more medical background than I do. So I often joke with my patients that because I'm the non-medically trained, I may be able to explain things in plain English or explain things in a different way to make sure that they understand, right? So communication between you and your team is really important. But if you're not feeling comfortable with that, or you don't know who to ask, or you think you have a silly question, talk to your social worker. We will not judge you for the questions that you ask. We won't think that they're silly. And we'll be there for you if you want to talk through some things with people. I'm also involved in our modality education for a very similar reason. So our patients come to modality education here on site and meet with our lovely nurses and get the information. And I go in after, or I follow up within the following days to check in to see, do you need anything clarified? How are you feeling about the information that you received? Because again, the information can be overwhelming. And so sometimes I have had people tell me, oh, I didn't want to say then, but I'm really confused by what this means. So I've been able to explain it, and with the caveat that I'm not a medical professional, and the information I'm giving is not medical advice or medical advice, and they really should be following up with a nephrologist or the nurses. But the communication is such an important piece of self-advocacy. So you're advocating for yourself for understanding, and if you feel like you're not being treated well, you're advocating for that as well. But you can also advocate for yourself to have as much knowledge as possible to be able to continue the journey as an informed person. You need to know what's going on with your health. You need to know what's going on with your kidneys to make an informed decision down the road. Another way that I do this for my patients is sometimes I help them role play conversations that they want with their doctor or with other members of their healthcare team. I recently had a new patient who came to us, unfortunately, from a crash start on hemodialysis. And I was talking to one of his caregivers who said, you know, we have this doctor in the community who is working with us in a different aspect. And I really want her to stay in our care, but I don't know how to ask that. So we role played until she felt comfortable approaching that doctor in the community and wanted to use me as a sounding board, which I was happy to do so. So communication is such a big piece of self-advocacy and such a big piece of self-management of care. And I just need to recognize, and I think we all need to recognize, that there are some people who are more comfortable with it and some people who are not. And I, as a social worker, am happy to assist with both sets of people. And if you want to talk through anything, please reach out to a social worker. And sometimes too, people just want to talk about their frustrations about the system. So I will be one of the first to recognize that our healthcare system is not the best. And the hospital systems can have systematic barriers and issues as well. So if you're struggling and you don't know who to talk to, or you don't know what the process is to follow up with complaints or concerns, again, as a social worker, I can talk to you about that process, about who to talk to. If you need to file a complaint, I can give you information on that process. Francine had also talked about self-care, and I just wanted to mention that self-care is actually also a really big component of self-advocacy. And what I mean is self-advocacy is really acting in your own best interest. So self-care is acting in your best interest. And it's really easy to get consumed by what's going on and letting it overshadow other things. But if you're not refueling your well-being, your physical, mental well-being, that can have some negative effects on your health as well. So I have patients who come to me and say, you know I should be exercising more, or I know I would feel better if I talked to other people, but I just don't know where to go, or I don't know how to start looking for supports and services. Prior to working as a social worker in the hospital, I actually worked for a non-for-profit community service agency in Toronto. And so I know that there are community supports available as well. But I know how sometimes it can be very hard to find these resources. So a social worker like myself can actually already have this information. So if you are struggling to find resources and supports in the community, that you're motivated, you know you want to get this, get going, you know you want to take care of yourself, but you really just don't know where to start. Again, I may already have the information. So that's another way that the social workers in your life may be able to help you. I also wanted to let you know that there are some programs specifically designed for self-management of care and to teach patients about self-advocacy. Unfortunately, there's none in my area, but your social worker may have information. I know that we had a panel the other day about adolescents who are transitioning into adult support services. And there is a self-management program called All You Need Is Love for adolescents who are transitioning. So there are some supports and services and programs that have been designed out there, and it may be beneficial for you to talk to your social worker and find out if there's a similar program in your area. I just wanted to finish off by saying that when I first started as a renal social worker, one of my coworkers said something to me that was really interesting and stuck with me, which is, when it comes to a person's healthcare journey, our patients are the driver of the bus. And it's true. You guys are what fuels you fuel your own journey. You're the one that's on this journey, and you know which direction you want to go into. And for people who are just starting, and even people who've been managing a while, if you get stuck or you find you need guidance, talking to a renal social worker is a great place to start. And I know for myself, I'd be happy to help you navigate on your healthcare journey. And I'm sure the other social workers in your lives would be happy to help as well. So that is how a social worker may be able to assist. I do see that we have some questions, and we will be answering some questions later on. So I'm going to pass it along to Andre, who's going to talk about this through his perspective as a nurse practitioner.
Thank you, Tyler. I'm just quickly going to share my screen with all of you here. Again, my name is Andre, and I'm a nurse practitioner. I work for Trillium Health Partners, which is in Mississauga, and I am a hemodialysis nurse practitioner. And I started out being an RN, emergency nurse by background, but then I moved into hemodialysis services. And my eyes were open to a new reality, which is living with a chronic disease. And I think as much as I love the action and the thrill of providing care in the emergency department, I think over the last 3 years since I joined the nephrology team, the renal team, I think I've grown as a person, and that growth has come from patients and what I've seen and how resilient they are as they go through their journey. And I think Tyler said it very well. You guys are the drivers of your care. And so after a while, after 2 years of being a dialysis nurse, I wanted to do a bit more. And so I went on, got my master's degrees, and I'm now a nurse practitioner. And this puts me in a very privileged position where I'm able to bridge the care that is provided by the nephrologists and the other multidisciplinary team members. And I get to build relationships with patients, and I get to know them really, really well. And let's be honest, the care, the nephrologist, the time that's allotted to the nephrologist, it's limited because of how our healthcare system works. And so I'm there to be that provider that's able to extend that level of care. And so I would say, just going off what I just said, I would say take advantage of the other healthcare members. I think patients initially, they have an idea of perhaps, like doctor, nephrologist, the nurses, and then perhaps the social worker. But there is a team team that works around providing care for you guys. And so I would say to you, take advantage of other members, whether it be a pharmacist, a renal pharmacist, whether it be a dietitian, social workers. If you happen to be in a hospital or a program that has a nurse practitioner, reach out to your nurse practitioner and ask questions. So I was thinking about self-advocacy and how I empower my patients to self-advocate. And the only thing, or the main thing that comes to my head is knowledge. And knowledge is power. And I like to share power, and therefore I share knowledge. It's quite interesting because what I've noticed is that the patients that have a better, let's say, outcome once they're started on dialysis, and I'll be specific to dialysis, so that's my area of specialty, are the patients that are more knowledgeable about their care and what's going on. And so the first thing I wanted to mention is, I'm going to talk about these 4 things, but the first thing I want to mention is patient-centered decision-making. And patient-centered decision-making is a plan, like a care plan or a model of care that we as providers use in the background to facilitate care for any of you guys, any patient. And so the aim with patient-centered decision-making is to make a decision that is informed by the best available scientific evidence and that is consistent with the patient's views on what is most important to them. So this sort of care model, or it's a care model. It's in the back of our heads every time we think about making a decision, a collaborative decision, and it's so important for patients to ask questions, and to share what they value the most and what they really want to get out of dialysis or whatever modality it might be that they're going through. And so at the beginning of whatever modality it might be, that if it's home hemo or PD or hemodialysis, I would encourage you to ask questions. And there is a lot of topics that you can ask questions about. I know a lot of my patients have questions regarding the type of fistula that they have, or if perhaps they're going to use a catheter. So if at the beginning there is a lot of knowledge and a lot of information being shared with the patients, and I try to be cognizant of that fact. And so sometimes I would ask my patients to perhaps bring a family member. And if you don't have a family member that you trust, then you might have a friend. And if that's not the case, I would encourage you to become or build a rapport, a relationship with one of your nurses, and ask questions. And you'll see that, by asking questions and by being more knowledgeable about whatever it might be, Ask questions regarding why are you using a blue needle instead of a green needle? Why do I have to take thumbs, or why do I have to take this certain medication? And why is my blood pressure so high? And what are the best medications for blood pressure? And if your nephrologist decided to give you, let's say, this medication and A medication and B medication, ask them, is this the best medication I can get for my current hypertension management? Or is this the best medication that there is with the least side effects? Ask these questions, and you'll be surprised how much you can get out of this. And I feel the moment you start making these interactions, you become empowered. And so, again, if you don't have a friend or a family member, I would encourage you to then, build a rapport with one of the medical professionals. Nurses, they're usually the person that you see the most, and ask them questions, and you'll see that you start gaining some knowledge about whatever it is that is going on, and then you'll be prepared to ask your nephrologist once they're rounding regarding specific questions that you might have. Tyler talked about this, and this is super important, which is using plain language. It says pain language, but it's plain language as an equalizer. So when we are providers, and I'll give you my perspective, when we're providers, we become, I don't want to say desensitized, but it becomes a norm for us to use certain language or terminology, right? And we do it because we want to be the most accurate or the most scientific or evidence-based. And so we like to use these terms, and it's always changing, whether it be medications or procedures. But I would encourage you to, if you're not understanding anything, to ask your provider to explain that in a different way. And let's say if you don't understand the word nephrology, for example, ask them what that means. What is nephrology? What is the equivalent to nephrology? And then once you hear kidney or renal, that might have a different meaning for yourself. So these are the type of questions. And I think this tool here, plain language, asking your provider to be concise and clear, in a way that you understand, it's a really powerful tool for you to have power. I would also say voice your fears. It doesn't matter. I know some people don't want to seem vulnerable, but allow yourself to be vulnerable and voice those fears with your providers. I fear that if I stay on dialysis, I'm not going to look the same. Or if I get a PD catheter, what's going to happen to the way my belly looks? Or would I be able to do exercise as I used to? And I think these are really healthy discussions. Or most people, and this is a big one, I fear of becoming a burden. And I hear it often. And people and patients sort of isolate themselves in an attempt to protect their family members, and they take the blunt of it. And I will say that's not a good idea. We can tell when you guys are overwhelmed with information. And again, I would encourage you to fear, your whatever it is that you might be feeling, because that would help us understand what you're going through, what's going in your mind in that moment. And we might be able to offer you another session to explain, or a session with a social worker and a dietitian together. And this is how you can go on to make better decisions. So voicing your fears. And I will say, just to summarize everything, once you've engaged your support group, might be friend, family, or another healthcare provider, once you're incorporated in your plan of care, what's truly important to you. And we do ask people when they're starting dialysis, what's important to them and their understanding of renal disease and what the outcome will be moving forward. So once you've voiced what you want in that plan of care, it might be, I don't want to do dialysis on a Saturday, or PD, it's too much for me, and I'm not able to have the freedom to work. All of that is patient decision making, all of those little decisions that you are able to make and you're able to voice. So don't be afraid. So, and once you've asked for simple, clear explanations, and once you've voiced your fears, only then you should feel comfortable making decisions about your treatment. And this, in the end, is informed consent. So you've heard this word consent, and consent is when you agree for a medical treatment to take on. And I will say, don't take this lightly. About the decisions that you're making. Ask your healthcare providers, and once you're corporate, you'll be much more empowered. So that's that for me.
Thank you so much, Andre, for that information. And we're now going to pass it along to Dr. Brian Forsley.
Okay, thanks very much, Tyler. I just have to say that I'm just jazzed out by listening to everything that everyone is saying, and I love all of the experiences and the insights that are being passed on. So I actually feel grateful to be here and be able to participate too. So I'm going to share my screen quickly here too. And so yeah, so I just wanted to partly say I'm very grateful to be here. I wanted to say thanks to Teresa Atkinson, who's an amazing person, for inviting me to be able to participate in this. And I live and work in the traditional unceded CL Okanagan territory. I am mindful of that every day that I go to work, and I'm very grateful to practice where I do. I don't. Honestly, I've been scratching my head through the other speakers, and I could almost throw out my whole presentation because of the depth and breadth of what's already been said, and honestly just say, like, everyone has already said it quite well. I loved listening to Elisa's experiences, that rotten emerge experience that she had, you know, landed on me. I felt badly even listening to it, but I also heard her, you know, say working on building relationships with your care providers, bring documents, be prepared. Those are great comments. I loved a lot of Tyler's and Andres' comments as well. Building relationships, all of it. For my part, maybe I'm just going to hone in on one bit that will be additive. And I just wanted to tell a quick story that really happened almost a week before I got invited to participate. And it was kind of a routine clinic encounter. I was seeing somebody as a phone consultation for the first time, and we were just going over what type of kidney problem they had. I ordered up some extra tests, and then the plan was that I would get together with them again after the tests were done, likely within a few weeks or something in that ballpark. And then it turned out that the next time that I was seeing them was about, I think, 4 or 5 months later, and I was reading my initial consult note and looking at the calendar and going, gosh, what happened? And you know, this might not seem like a big thing, but for me, our wait lists are in terrible shape right now, and I always feel badly when things misfire like this. And I suppose if I had one extra bit to add to the discussion, it would be to ask for the consult note. I mean, after you see a physician, there always will be a consult note that goes out to the family doctor. And I think it's a great idea to get your hands on the consult note for a number of reasons that I'll try and just unpack a little bit. The first is that it's not the case that anybody can absorb all of the information that's provided in a given discussion. I mean, it'll just never be the case, but there's an opportunity to read through, okay, here's what they looked at, here's what they're thinking, here are the next steps. That would allow you to prepare for the next visit and be able to get your head around what are my questions and that I want to ask. I love it when people write down questions and bring them in. It's not a big deal or overbearing at all. I feel that I know that the time that I'm spending with somebody when I'm answering their questions is going to be high value time, so I feel good about it. You guys, most physicians I think would feel that way. So having your hands on the consult note lets you be prepared. In the case that I just described here, I think that the consult note is one tool to help a person get unstuck. And, you know, tests get ordered, time goes by, things get lost. If you knew that the intent was to get some CAT scans and some lab work and then be back in the office in the next 2 weeks and things are not unfolding that way, that gives you an opportunity to call the office back and say things appear to be going backwards. I just want to check in and see, did the radiology department get your CAT scan requisition? And there's just so many steps along the way for a plan to unfold perfectly. There's so many opportunities for things to go awry. There's that if you're alerted to the fact that things are not going well, it allows you to go back to the, for me, I would want somebody to come back to my office and check in and say, hey, things might have gotten lost. Can you look into it for me? That kind of thing. Building relationships. So this point has already been made really well, but asking questions, saying when you're confused about something, that's nothing to be ashamed of. I believe that especially when we're talking about big, heavy-duty discussions like starting or stopping dialysis or a fresh new diagnosis, especially if it's a very serious type of kidney disease, I think that people often can be emotionally in a little bit of a shell shock kind of state, even if you're not aware of it or don't want to share that you are, and not everything's going to soak in, and it's okay to say, look, I don't think that this is all soaking in. Can you go over it with me one more time? And that can happen on multiple visits over time. And I think that if you build relationships with your care providers or the whole team, that I think you'll find that people want to meet you where you are and get you to where you need to be. Maybe the last thing I'll say is self-monitoring. For most types of kidney disease, once the initial diagnosis is made, and there's often a big period of time where really you're just trying to hang on to what kidney function you've got by looking after blood sugars for folks with diabetes or looking after blood pressures. And there's a huge role for self-monitoring. And then calling for help if you have that consult note and this is what the blood pressure is supposed to be, or this is what we're shooting for blood sugars, and you find that you're not there, then I love it when people call the kidney clinic and say, look, I'm not where I'm supposed to be. Can we do something on the fly? My appointment is not for another 2 months or something like that. So you will get that information ideally from the consult notes, and so it's a bit of a tool that you can have. Lots of consult notes will not be done in perfectly neutral, easygoing language, but that can still lead to good questions during the next clinic visit. When I do my consult notes, I try and do them in as much as possible a lay language so that they're accessible, and I print and I provide them to people as a general rule in my private office, or if I'm sending somebody home from hospital. And so I would encourage you guys to try and get the consult note. Beyond that, I think that I would echo everything that's already been said by all the other panelists. I think it's all great information. And so I can wrap up to make sure that there's lots of time for questions for everybody. Thank you.
Thank you so much. And thank you to all of our speakers today for the valuable information provided and their insights. So we do have some questions, and we will certainly take some time to answer those today. And so let us see. Okay, so the first question is about My family member has just been diagnosed with chronic kidney disease after no warning and an acute hospitalization. She was in the hospital for 10 days and out of hospital for almost a week. She will now need a dialysis and a transplant. What should we do? What should we be doing or asking to advocate this stage? What do we not even know to ask or ask about this stage? So Elise, I think you would be a good fit to answer this question.
Yeah, I saw that question pop up and immediately started typing out some notes to myself to answer that question. So I'll be quick. I'm not sure where you're located, but in many provinces, and I know in BC, we have kidney care programs now in place. So when you get assigned to your kidney care program, you'll be provided a nephrologist, a nurse, a dietitian, and a social worker. So depending on where you're located in Canada, that's a huge resource, and I use all of the people on my team frequently. So some questions that I would bring up is if you're not even sure what eGFR is, and that's how your kidney function is monitored, ask a definition from your team so that you know what it is. Ask what your actual eGFR is, and all the information that goes with that. If there's other issues involved, such as diabetes or high blood pressure, each patient is very different. So each patient will have a different diet that they need to follow based on their lab work. Different water intakes. If you're on dialysis, then your water's limited. If you're not on dialysis, and in my situation, I'm encouraged to drink a lot of water, and that helps with my specific kidney disease. But I think what is really different with kidney disease as opposed to maybe other situations is that each patient has very individual needs. For me, I need to watch my potassium levels because my potassium spikes sometimes. So that's something I monitor, and I monitor my sodium intake. So those are all things that will need to be assessed by your own medical team based on your own very specific numbers. For PKD, we are told to avoid contact sports, and I believe that's for many kidney patients as well. So ask the team, is there activities you should be avoiding and activities that you're encouraged to do. I like to go for long walks with my dog. My last 3 years, my health has been really, really terrible, and I'm finally on an upswing. So I'm getting to be more active. I've re-engaged with my personal trainer that I was using before. And so trying to find out activities that are good for your health and those that you need to avoid. Something that Dr. Forzelli, I believe is how I pronounce his name, mentioned is bring someone with you to the appointment. So if this is your friend, if they have a spouse or a partner, have someone that can bring a notebook with all these questions already laid out in your notebook, and have them ask the questions or bring up a question that you have not asked yet. So one of my first appointments with a genetic counselor I brought my cousin, and I had provided her all the questions I wanted to ask beforehand. Before we left the appointment, she brought up a couple questions I had forgotten to ask. So that's really helpful, because when you are the patient receiving that information, it's really hard to take it all in. So the patient doesn't want to be the one that has to write everything down. If you have someone that's dedicated to taking notes on your behalf, that's super helpful. And I've done that many times. A few other things, and I know we're on a tight timeline, so I'll be quick, but a few other things. Ask about your hospital's transplantation and dialysis program. For dialysis, there's a lot of different options now, and again, it's going to be patient specific. So discuss the pros and cons of each of the options, and discuss what your lifestyle is. So sometimes, for me, I don't think I want to do peritoneal dialysis. I believe I want to do hemo because I know the pros and cons, but that's for me. And everyone will have a different lifestyle and a different option that will fit best in that lifestyle that you have. And then what are the restrictions for the different options? Like I said, some dialysis options, I believe you have to restrict your water intake and have a pretty restrictive diet. So that's important. I had never actually requested my consult notes, so that's a really good thing that I didn't know that I could even do. So I'm going to be doing that in the future. And then also, so I mentioned which hospital you'll be going through. I know I'll be going through St. Paul's for my transplant, and when that time comes. And each hospital will have a dedicated nurse to engage with potential donors. So as a transplant recipient, I would have nothing to do with the donor process. I'll be assigned a nurse who will, and a number that I can give out to people that seem interested in being a donor. But once I hand off that phone number, I have nothing to do with the donation process. So understanding who your team will be when it comes to the time to have a transplant, and understand the process. There's a lot of testing that goes on to be a donor.
Yes, thank you, Elise. And I just wanted to say too, like, feel free to ask some practical questions, like where to go when you get there. Ask about parking. Ask if they can have visitors through COVID. Like, I know our unit, we weren't having visitors, but we're slowly starting to take away those restrictions. So if it makes you feel better, or your family member to feel better, to have somebody with them during treatment, ask if you're able to join. And I've even had some family members come and ask to see the machine and to see actually how it works, because it made them feel better. Knowledge is power that Andre was talking about. Like, knowledge is power, and it's empowering to know exactly what's going on in that information. I did see that there was a question about how to access a social worker, and Dr. Forsley has answered it. So yes, you would need a referral to a renal program to access a social worker such as myself. Each clinic would have their own eligibility. So I would suggest talking to your family doctor or your community nephrologist to see if there's a kidney care clinic, but it usually has to do with what state your health is, if you need a multidisciplinary team. But I will say that the Kidney Foundation is actually a great source of support and information. So if you are struggling with needing information or need someone to talk to about how to self-advocate, and unfortunately you don't have access to a social worker, you can be connected to the peer support programs through the Kidney Foundation, and the Kidney Foundation has some really great programs, which I'm sure you're all aware of because you are joining the Kidney Foundation Patient Forum. Yes. So there was a comment about that I'm able to see pre-dialysis and someone who's advocating for themselves in the community. So for that person, yes, you already are doing an amazing job advocating and getting your dietitian involved. I would maybe suggest talking to your MD to see if there's a renal clinic in your area, and see, the process about going about that, and see what your doctor says. And the Canadian system can be frustrating for some, and I want to acknowledge that as well. There is a question about getting clinical notes and taking notes in clinic visits for 20 years and finds it helpful. Reassures me that clinicians are taking me seriously. Yes. Yes, for sure. Wonderful. Well, we are almost out of time. So I really do want to thank everyone for joining us today. And thank you all for all the panelists for providing information. I hope everyone who's joined has found it as helpful as I've actually found it as well. I really enjoyed learning from my panelists, my co-panelists as well. So thank you everyone for being here and listening to what we have to say. And thank you panelists for answering those questions. And I'm gonna hand it back to, I believe, Lydia.
Thank you so much to all our panelists and speakers today. It really has been a pleasure having you today at our patient forum. And with that, I would like to invite you to our next session on research, and then that'll be followed by Cooking for Kidney Health. I really hope to see everybody soon. Have a great afternoon.